Here from Orlando, Florida, it's HIMSS 2019, as this is CommonWell TV. Scott Adams here with you as we introduce you to some of our CommonWell Health Alliance members. Time now from one of our founding members, that being Change Healthcare, as Nicole Antonson, the VP of Product Management, joining us. And Nicole, why is interoperability so important to our nationwide healthcare system?
Yeah, well, certainly as healthcare costs rise, so do the need for value-based payment models as well as consumerism. So for value-based care payment models, it's to mitigate those rising costs. For consumerism, it's to help those patients navigate their healthcare. And that's either at the point of care, so right with the physician when they're there, or maybe it's coordinate that care across a continuum of their healthcare experience, maybe even managing a chronic disease. But those patients are mobile. They move around. They expect their data to move with them. They can't, trek along a suitcase with them or memorize all the locations where that data may exist. So interoperability provides us the foundation to locate that data, make sure it matches to that patient, and then also to retrieve that data in an efficient manner. So, also with providers, one provider may have to coordinate with 200 other providers to care for their patient population. And they can't do that. They can't have a staff locating all that data, but they need interoperability services to bring that data back to them in an efficient way to drive better outcomes, mitigate costs, etc.
Well, we are seeing a lot of change and advancement in interoperability. And with that change, how do you see that impacting CommonWell, and at the same time, how necessarily we begin to go forward with those advancements?
Yeah, well, I'll certainly say CommonWell, great growth. When we did these interviews last year, maybe we were at 20 million unique persons on the network. In that 1 year, we've grown to 47 million patients, and I believe that's because of CommonWell's investment in things like auto-linking, the care quality CommonWell integration, as well as investing in notifications, all of those being features that are really important to those patients, to those providers, to accessing their data in a more efficient way. If we didn't have those features, I don't think we would have seen that growth. CommonWell has consistently continued to invest in the future with additional features. So we're more investment in the auto-linking, but we're also moving to providing patient access to the data. So that's an approved use case. I think with the advancements of apps that are out there right now on all of our phones or with our providers, that making that data more available with CommonWell is really important. The other piece I would say important for the future is investment in data quality. So it's one thing to provide the data, but it's making sure that all those members are working together to provide higher quality of data out to the providers.
Specifically, what is Change Healthcare doing to really advance interoperability?
Yeah, so from Change Healthcare, we are the service provider behind CommonWell, and we make it scalable, we make it secure, and we make it affordable. And so from a scalability perspective, we haven't missed an SLA for the Alliance yet, and we continue to invest with our announcement in AWS. So we just had the HIMSS show, so we continue to invest there because we know we're going to have to scale from that 47 million patients, especially as we bring on the patient access use cases. And I think there'll be other use cases such as payment and operations. All that volume, Change Healthcare is ready to support that, and we're making the investments to do so. From a security standpoint, working with our members, so as we bring those patient access use cases on, let's make sure we don't have any bad actors coming onto the network. As individuals tap into the network versus vendors are tapping into the network. So that's really important. And then the last piece, affordability. Worked with the Alliance this past year on new pricing to bring in the smaller players. So the founding members were these much larger vendors, but now with these smaller apps, PHRs, et cetera, smaller EHRs even, we can bring them on a more affordable way. So
and getting everybody on board for the one more common good, if you will.
Yes.
So the CommonWell connectors have recently been put out to the forefront. How is this really going to change the game?
So there are smaller players that just don't have the resources or the skill set to build that gateway with CommonWell. And so Change Healthcare, we are both a member and we are a service provider as well. in both positions and in both things. We would like to help those folks who don't have the skill set or the resources, help them connect to CommonWell. If they can do it on their own means, a provider or EHR can do it on their means, they should go to CommonWell directly. But if they can't, Change Healthcare can help them with that. And I think that that's going to be necessary over time.
Change Healthcare, one of our founding members of the CommonWell Alliance. And for more on them, we invite you to log on to CommonWellAlliance.org. Thanks so much, Nicole.
Thank you.